Urinary control problems and how to treat bedwetting. Urinary control problems, also known as urinary incontinence, are relatively common and can be quite distressing for those affected. Since many cases of incontinence can be treated or improved with therapeutic methods, this program will cover the following topics: what causes incontinence and how to treat bedwetting. What is urinary incontinence? Urinary incontinence refers to any difficulty in controlling and retaining urine, resulting in involuntary leakage. About 13 million Americans suffer from some form of urinary incontinence, with 85% of them being women. This problem is more common in women and people over 65, with about 1/3 of men over 65 and nearly half of all women experiencing some degree of incontinence at some point in their lives. Urinary incontinence is not a disease in itself but a symptom with various possible causes. Therefore, the first step in treatment is identifying the cause. What causes urinary incontinence? To understand the causes of urinary incontinence, it helps to know a bit about the structure of the bladder and the mechanism of urination. The bladder, which stores urine, has two muscular valves called sphincters that are usually closed. We cannot control the internal sphincter, which opens reflexively and involuntarily, beyond our control, when the bladder reaches about 200 to 250 milliliter of urine. This causes urine to move to the external urinary sphincter. At this point, the individual feels the need to urinate. The external sphincter is responsible for controlling and holding urine until the person is in an appropriate place to urinate. This external sphincter is not functional at birth, which is why infants and young children cannot control their urination. As a child grows, they learn to control their urination at the request of their parents. If, for any reason and at any age, the internal or external urinary sphincters fail to control urine flow, urinary incontinence occurs. Causes of urinary incontinence in adults. Common causes of urinary incontinence in adults include urinary tract infections, constipation, weak bladder muscles, nerve damage controlling bladder muscles like MS and diabetes, enlarged prostate in men, disabilities and diseases that prevent timely bathroom use, prostatitis in men, certain medications and substances. It's important to note that urinary incontinence may occur temporarily due to factors like urinary or pelvic infections. Additionally, a person may experience two or more types of incontinence simultaneously. Causes of urinary incontinence in children. Urinary incontinence in children is relatively common and sometimes resolves on its own. The causes of nighttime incontinence in children are often unknown, but common causes include anxiety, attention deficit hyperactivity disorder (ADHD), diabetes, deficiency in antidiuretic hormone, obstructive sleep apnea, urinary tract infections, caffeine, overactive bladder, small bladder, anatomical problems in the urinary system. How to treat bedwetting. To address bedwetting, the first step is identifying its cause. Your doctor will determine the appropriate treatment after a physical examination and a thorough medical history. Here are some ways to manage urinary incontinence. Be mindful of certain foods and drinks. Caffeinated beverages and foods containing chocolate increase urine production and urgency. Drinks like tea, coffee, energy drinks, and carbonated sodas fall into this category. Reducing fluid intake, especially before leaving the house or before bedtime, can help manage incontinence in some people. Alcohol consumption should also be minimized, as even one bottle of beer can increase urine production and urgency. Maintain physical activity and manage weight. Certain types of incontinence, especially stress incontinence, are more common in obese individuals. Increased weight and abdominal fat exacerbate the problem. Exercise, sufficient physical activity, and a healthy diet can reduce this issue. Regular bathroom schedule. This method helps individuals with urge incontinence or reflex incontinence to avoid emergency situations. A doctor may recommend that the person use the bathroom every 2 to 4 hours or at set times. Gradually, the individual may extend the time between bathroom visits, training the bladder to hold more urine and control urgency. This is known as bladder retraining. Strengthening pelvic muscles. This involves specific exercises that alternately contract and relax pelvic muscles to strengthen them, known as Kegel exercises. Other methods include vaginal weight training to strengthen vaginal muscles. These exercises should be done under medical supervision. Pelvic muscle strengthening may also involve special techniques like magnetic therapy. Medication. Sometimes, increased urine production or incontinence results from the side effects of certain medications, which can be resolved by stopping the medication. Additionally, specific medications can be prescribed to treat or improve incontinence. Individuals with urinary incontinence should consult their doctor and not delay treatment out of embarrassment. Nerve stimulation. For those with overactive bladders who do not respond to other treatments, a device generating electrical currents may be used to help control the bladder. However, this method is not suitable for all types of incontinence. Surgical treatments. If other methods are unsuccessful, various surgical treatments may be considered. For instance, for overweight individuals or those with urge incontinence who leak urine when coughing or laughing, bladder neck surgery may be recommended to lift the bladder. Other surgical options include inserting an artificial urinary sphincter and collagen injections around the urethra. Thank you for watching. If you found this program helpful, please subscribe, like, and leave a comment.